Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
As you may or not know that we discussed the fact that the National Academies of Science, Engineering, and Medicine had looked at the organ transplant system and had determined that it was inequitable in the way it addressed transplantation, particularly as it relates to Blacks and other minorities. And it had identified 14 uh, recommendations that they made relative to making changes so that the system would be more equitable. This came out, I think, last February. Yeah, last February. And one of the things that they mentioned was the immediate change of eliminating. One of the things that they had in place was that they had a different way of equating kidney disease in African American patients because the males have more muscle and more creatinine, and therefore they had a separate way of measuring the glomerular filtration rate in African Americans in contradistinction to other ethnic groups. And they said immediately that that should be eliminated because that was likely to keep more blacks from getting kidneys. And so that's one of the things that they had actually talked about. In terms of difference in patient and graft survival in transplant groups, it's interesting that blacks have more rejection and do worse and wait longer than all other ethnic groups. And they also have poor results after transplantation than other ethnic groups. Asians have the best success, but for reasons we're not clear, African Americans have the poorest graft survival. Some of it we think is related to uh, our, the fact that we have some genetic differences in terms of APOL1, which is one of the issues that they've suggested. But I think institutionalized racism and social determinants of health may play a greater role than we like to think. But anyway, that's just some of the issues that have caused the organ transplant system to be uh, criticized greatly over the last 6 months. Although, on a positive note, we perform more transplants than any other country in the world. We performed 1 million transplants already, and we have every year the number of donations is increasing. However, the biggest problem is that the shortage of donors is the biggest problem. We have more than 100,000 people waiting for transplants, and about 99,000 of those are waiting for kidneys. And as a consequence, we do about 40,000 transplants a year, which means we have a disparity of about 60,000, which results in 17 people dying every single day because of the shortage of donors. So that the real problem in the elephant in the room is the shortage of donors. Now, dissecting even further, one can look at the success rate of transplants between different ethnic groups. And I wrote a paper about 10 years ago that talked about the fact that uh, that blacks, when they receive kidneys from other ethnic groups, make them do better with other ethnic groups than their own uh, ethnic group. Uh, but so it's a complex issue that has been dealt with for a while, but not successfully yet. And so the NASEM, which is the name of the group, indicated they would give him about 5 years to make some corrections, except for the glomerular filtration rate issue, which they said should be changed immediately, and it has been changed. So that's just some of the aspects of an issue that has come into great discussion. As a consequence, the four historically black medical colleges have joined with the American Association of Organ Procurement to work together to try to address these issues and to try to make the transplant system more equitable. So that's just a short answer to your long question. But does that address some of the issues you mentioned?
Yes, yes. But I was also interested in the reason why the actual glomerular filtration rate is used in comparison to the estimated glomerular filtration rate. Is there a cost factor?
No, no, I don't think so. But that was changed right after that was brought up. But they they thought it was logical uh, uh, because of the creatinine in males, and they thought it was. I don't think it was a cost factor. I think they thought we were doing the right thing. You know, sometimes Hitler thought he was doing the right thing too. But yeah, they thought they were doing the right thing, but it wasn't the right thing.
Thank you.
Okay. Uh, you want to start, John?
Okay.
Okay. Very interesting topic that we're trying to do something about. There are other issues that also on the table. This is an article that talks about the 5 of the best exercises you can ever do, recognizing there's so many exercises. And of course, this is uh, their opinion, but they talk about all the things. You know, so many people have gyms in their homes that they never use. You know, they have the treadmills and all these things, but they never use them. Well, so they're saying that if you go to a gym, you kind of wonder, uh, is that for you? So they decided to look into the 5 what they thought the best exercises, and they thought that swimming was one of the best workouts because it does so many things, and it does so many things. Although it doesn't help you with your gastrocnemius in terms of the pumps from the legs, but other than that, it's excellent exercise, and they talk about it number 1. Number 2, they talk about Tai Chi, series of movements that tries to give you balance. And uh, as we get older, of course, that's one of the things we lose, and that's why we have so many falls, because we don't have balance. That's one of the reasons. The other reasons, so they recommend Tai Chi, and then thirdly, they mentioned muscular training, and I think that all exercise should include some strength, some muscle uh, exercises in order to be fully helpful. So that the aerobic exercises are wonderful, but to add strength training is important. You don't have to lift a whole lot of weight, but lifting weights is good. Then, of course, number 4 is walking, which is simple but powerful, and it is probably the simplest way to overcome the needs for exercise. And they talk about 30 to 60 minutes on most days of the week as being actually 30 is the minimum. And then, of course, something we haven't talked about much, and I talked to our gynecologist to talk about the Kegel exercises, which came up in another talk about how pelvic exercises that increase the muscles that support the bladder and the and the whole pelvis, the rectal tract, the GYN tract as well. And so that these are the 5 exercises that they talk about. The Kegel exercises is the part that we tend not to talk about much because we take for granted something that is not something you take for granted, which is that you're able to keep yourself from becoming incontinent, which is the term that we use when you pass urine without effort and pass gas and stool, mostly stool, without the muscles that the sphincters, we call them sphincters, but they're muscles that allow you to start and stop your urination and start and stop your defecation process. Any questions about this? I think these are all things that we can do. Once again, the minimum is 150 minutes a week. But that's, to me, that's the starting point. Yeah.
I wanted to comment briefly about Tai Chi. We used to do that some years back. Tai Chi is a martial art, believe it or not, and so it offers some extra benefits, self-protection, things like that. But to me, it was very difficult. The movements themselves weren't difficult, but remembering all those the series of movements was very, very challenging for me. But it was real good.
Yeah, I took Tai Chi myself, and one thing that it did for me was it built up my quad muscles around my knee, just above my knee, because there's a lot of crouching that you do when you do Tai Chi.
Any other comments? If not, we go to the next one. And then, of course, exercise boosts brain health and improve memory. So 10 minutes of these exercises they talk about are very helpful in terms of keeping your brain alert. And while we talk about the physical exercises that also promote circulation to the brain, there are also other things that one can do in addition that also we tend not to recognize that the mental workouts that help your mind stay in focus and that if people would spend as much time with mental exercises as they would with watching television, they would do well. I think one of the things that we talked about before is that it's not only exercise, but meditation that also allows you to have what you might call mental gymnastics. And much of the data has identified that working out regularly decreases the likelihood of cognitive decline and dementia. And this is the data that they have. Decline is twice as likely in patients who are inactive versus those who are active. So once again, the data makes it clear that exercise is good for the brain, but also that there are other aspects of the brain that function that we should deal with. And meditation, I think that you should spend at least as much time with meditation and mental exercises as you should do with your physical exercise. So I think that they then talk then about those specific things that good for your memory. Dancing now. Remember Glenn Farrell and his group used to have the dancing, and then that was good not only for the exercise but also for your memory. Squats, it's something that they talk about. Uh, Anybody do squats? Because that's another exercise.
Yeah.
Yep.
Yes,
Part of
another.
yoga.
Yeah.
How do you, of those you do the squats, is that any more difficult than any other exercise?
No.
Hmm. Okay. Now, one of the things that is an exercise that some people don't appreciate is the stairs, walking up and down the stairs. Of course, John Tatum talks to us about how he used to walk up 4 flights of stairs and how much exercise that did for him. And that's also walking your dog is. It's clear that people who have dogs live longer than people who don't, for the most part, because they walk their dog every day. And they're more vigorous exercises, as you can see here. Dancing is still running, jogging, swimming, biking. Uh, I think they also, I think Val talked about how skipping and how all of that can help. The only thing that's not advisable is to do nothing.
Doc, one of the additional benefits of lap swimming is meditation, because while you're swimming, I seem to really kind of meditate while I'm doing it.
Right. And while you're walking, you can do that too, and all those things. Yeah, except yeah. And you can combine those things. You can combine meditation with a lot of those things, right?
Yeah, Dr. Callender, for those people who have long-term illnesses and they're confined to a hospital or those other places, rehab places and so forth, I realize how far you get behind on your exercise. So when you get out, you got to start from scratch. Because like you were saying, I used to go up 4 flights of stairs to the group sessions at Howard in the Towers building. And now I can hardly go up 2 steps.
2 steps or 2 flights.
2 steps.
Yeah, well, yeah, and they talk about the fact that stairs are an easy exercise. Well, I wouldn't say easy, but they're exercise. You can walk up and down the stairs, a flight of stairs, and exercise. So it's a cheap exercise. It's a cheap gym in a way.
Thank you.
Yeah. I'm a little. It's interesting now that we talk a lot about exercise and about everything else except. I'm glad that we had this article because it talks about exercise in the brain, although it doesn't talk specifically about meditation. I think it's an unsung hero of the day, meditation, which should be done as often as you do the aerobic and other exercises. You ought to do the meditation and the mental exercise. We go to the next one. Now, this is an article that qualifies and talks about as you age, need the muscle strength, but it's the exercise capacity that really allows you to have cardiovascular health. And this specifically talks about the plaques, which are these deposits in your blood vessels that reduce the plasticity of the blood vessel and actually eventually can block the arteries. Of course, Louis Ivy was a cardiac surgeon, so he did the bypasses and he helped correct those people who's build up those plaques and closed it, and this of course caused heart attacks. But points out that these the aerobic exercises actually reduce the number of plaques that form in the coronary arteries. Lou, you want to say anything about that? I guess Lou's there.
Just trying to unmute. No, in terms of the heart, we found that the plaques primarily were from cholesterol and so dietary implications caused most of the plaques rather than reduction in exercise. But I think the heart is a little different to the other areas in that regard. But beyond that, I have nothing to add.
Okay. All right, but anyway, it's good to recognize that these things go hand in hand: dietary discretion, as well as exercise, and of course meditation. So.
You know, Doctor, it might have went with the last subject, but you know, when a lot of people talk, you know, we're talking about people getting into exercise and maybe just walking, and that you know, a lot of people are just doing it for the first, you know, not for the first time, but they're incorporating. Now it's an exercise of mine, and just being aware of what they're doing. I mean, a friend of mine was just walking her dog and probably was on the phone and tripped on the sidewalk and broke her arm in 3 places. And you know, and you see it all the time, people walking down the street on their phone, and you know, and how people need to be aware that I'm doing something that can be dangerous if I'm not paying attention.
Well, that applies to almost anything if you're not paying attention. But
Right.
Walking certainly improves the circulatory system, the venous circulation, as we mentioned earlier. So all the muscles and the brain, every part of your body is made healthier by walking, purely because of the increase in blood flow to the organs.
Mm-hmm.
But it's interesting that he mentioned the issue about people not paying attention. People now cross the street on their cell phones, and we're having more accidents. People getting hit by cars and other things because, as you mentioned, not paying attention. So
Right.
I've seen people walk into lampposts,
yeah,
but on their cell phone. But
yeah.
I had a question for Dr. Ivy though. I was just looking at my my after visit summary from my primary care doctor. I have a new doctor who went to Howard. His name is Adrian Hurley. Anyway, one of the things that they checked off was atherosclerosis of the aorta. How would they determine that? I know the aorta is the heart, right? So
It's the biggest blood vessel in the body. The blood leaves the aorta, leaves the heart, and goes to the aorta, which is the arterial pump. Lou, you want to answer that?
Yes, we call the aorta the red racer in cardiac surgery, and the only way that you can really determine whether or not it's being occluded, which is a collection of cholesterol or other material in the walls of the aorta, is through the symptoms that may occur from reduced blood flow to the extremities, and doing an aortogram to actually see it. But you may check the blood cholesterol, and that might give you some hint, but the symptoms are basically what cause your attention to the narrowing of the aorta.
Because nowadays people get MRIs and other X-rays that are able to identify plaques in the coronary arteries and other things like that. So X-ray is one of the ways, and ultrasounds also.
I'm concerned because I haven't had any of those type of tests as far as I remember. I mean, my cholesterol is good, and I just got put on that statin, and I mean, you know, just in a month, my cholesterol has really dropped off. So I think that's good, but I've never had a cholesterol issue. I was just wondering how it got on my summary here.
Well, if you have, I don't know.
What was the basis for that diagnosis?
That's what I'm asking. It's just, you know, they have you know, what we talked about in my visit, but I was
I'd
just
have to speak with your doctor.
okay.
Yeah.
All right, thanks.
Elizabeth has a question.
Pardon?
Yes,
Yes, good morning, everyone. Dr. Callender, I've heard everything that was said, but since I'm not even though I'm a wellness coach, I don't deal with the medical side. And I'm trying to figure out a simplistic answer for this. I noticed that not in my family, but in another family that's close to our family, I noticed that the mother, it was two mothers and two sons, okay? But the mother of the two sons, okay. I noticed that with the mother, I think she died at the age of 85 or 90 something. But one of the son-in-law kept telling her, if you don't move it, you'll lose it. And he kept telling her that constant. And so we decided to help out with the caregiving for a couple of weeks that summer. And two adult men had to help her up the stairs because she could not move her muscles. And she would sit in front of the TV all day long and only go to the bathroom, etc. But then she had a high dosage of blood pressure medicine. And then I noticed the brother who had been in the military, he had a high dosage of blood pressure medicine. And he fell one day in the house and couldn't get up. The ambulance had come. Then I noticed another brother with several diagnoses, but
what do you know any updates on what?
So I'm just trying to understand this. The blood pressure tying into the muscles.
well, one of the things that we haven't talked about, and actually we have a geriatrician who's going to be talking to us shortly, Dr. Obisasan, is that all of the medications that you take for anything, especially blood pressure medicine, has side effects. And some of the side effects may be responsible for, and even sometimes some of the statins can have side effects that reduce your ability to get around. And if that's the case, then they should be changed because the observation is correct. If you don't move it, you will lose it. And but a lot of what you speak about could be a side effect of the antihypertensive medication that is given, because uh, if the medication you're given for one thing produce side effects that uh, cause you to be inactive, then you need to have the medication changed. But I'm trying to think of a way to address the issue. But what you speak of sounds like the maybe some of the side effects of the antihypertensives. And there are antihypertensives that don't have those side effects, so you need to be on an antihypertensive that does not give you a side effect of inactivity.
And of course, the aspect that you mentioned, the person who is sedentary, sits around all day and does not move a lot, and may gain weight and be on antihypertensives. All of these things contribute to the loss of the strength in the muscles of the legs. So she couldn't get up and walk. And once you fall down, you can't get up. And that's my problem. That's why I don't do squats. I can get down, but I can't get up.
Elizabeth, did you have any?
No, thank you very much. That was very, very helpful. And thank you for breaking it down that way so I get a good understanding.
Yeah, I'd be very careful about any blood pressure medicine that reduces your ability to exercise and get around.
Yeah,
And we have so many antihypertensive medications that don't have that side effect, so there's no excuse for that being allowed to continue.
yeah, because over the years, of course, I was very particular about what my kids ate and what my husband ate. And of course, that made me sort of like the black sheep, but I didn't care. and as a result, I saw them decline in the other families, where one family member of that particular family, he looks younger than the brothers, and he, thank God, has not had any of these side effects. But it was just something that I thought about over the years. I saw as they decline with those muscles. So I was very concerned about that. Thank you so much. I really appreciate your comments.
Okay. This is interesting because you see so many commercials that talk about low testosterone levels and how this is, when you age, your testosterone level does decrease. And I guess there are medications that can increase libido, increase the sexual activity, as well as recognizing that you may have a testosterone deficiency level. And so in that case, you can get blood tests to find out if your testosterone level is low, and also you can take medication that normalizes it. And this is something that we see so many commercials about, and it's real. Of course, as with anything else, if your testosterone level is normal and you take this medication, then you can have side effects. But this is.
I think that estrogen levels as well as testosterone levels decrease as you get older. The idea being that the ovaries are not functioning like they used to, and neither are the testes. So the idea of their activity when you're younger is that there's procreation. We're supposed to have children. And as you get older, that need is not there. And of course, there are other effects that the hormones produce. Estrogen, the feminization of women, the hair, all the features of a woman come from the effects of estrogen. And of course, when women get older, they may not want to lose those features. And they go through menopause and hot flashes and all this kind of thing because the estrogen level is dropping. And they tend to substitute estrogen medication to reproduce those things. But that we have found lends to increased likelihood of cancer and other factors. So you have to be very careful about that. And we must recognize the fact that as you get older, these particular hormones are reduced.
Increase in estrogen will also decrease testosterone, and there are several foods that will increase estrogen levels, including soy. So soybeans, edamame, all those are all soy derivatives, and it will increase estrogen.
I had a question, both of the doctors, about all these commercials you mentioned. They all say that these medications are not clinically tested. They're not supposed to treat or cure any disease or disorder. It's hard to really, listen to all that stuff, without laughing because, I mean, and they make a lot of money off of those, and they're not regulated either, as far as I know. What do you think about that?
I think that that's accurate, and I think that the wise person would get the testosterone level and find out to whether or not the testosterone level is low, and then one could then take advisedly medications to and normalize the testosterone level.
So if you went to a doctor, what medication would they give you a medication or tell you to go to the health food store?
If your testosterone level is low, then they would give you testosterone.
Oh, okay.
Yeah, so it's a medication that can be administered, just like estrogen, as Dr. Ivy said. It's just that it's more common for people to talk about estrogen because women, they talk about it all the time. But for men, what they actually are trying to talk about is erectile dysfunction. They don't want to say that on television, but that's what they're talking about, erectile dysfunction. And one of the ways of treating that is if you have a low testosterone level is by giving you testosterone. And that's what's in these medications they're talking about. It's testosterone.
I'm just looking at an internet thing that says that increased sexual behavior increases testosterone. And it's not only behavior, but it's watching. And so actually watching porn or having more sex can increase your testosterone. So you got to get busy.
Yeah, but if your testosterone level is already low, then that may be helped by testosterone. Yeah.
Some other foods that increase estrogen: flax seeds, soy, peaches, garlic, red wine, sesame seeds, cruciferous vegetables like cabbage, Brussels sprouts, and nuts. So those are the highest foods in estrogen.
Well, the highest production of estrogen comes from the ovaries. So anything else is supplementary, and you consume a considerable amount of that to substitute for the estrogen from the ovaries. But most of these hormones we can find in foods all around us. That because historically, man did not have estrogen tablets available to them historically, and so nature provided a lot of these things that we have become accustomed to, and the concentration of the particular hormone goes to the organ in the body that uses that. That's the ovary and the testes.
So what these medications, what you see on television, are really just testosterone replacement therapies, actually. That's what it is.
All righty.
Okay, next one. This is an article that we've talked before about how dark chocolate is the chocolate that has the most antioxidants. What we haven't talked about is the fact that there's been a complaint that they also have excessive amounts of lead and cadmium. And these are poisonous to the system. And while dark chocolate is actually the preferred chocolate, it has been associated with lead and cadmium, and so the consumer report suggests that the people who make the dark chocolate should eliminate lead and cadmium from the product, and that's what this article is all about.
I'd be concerned as to how they would do that. What would they do to the chocolate to get the cadmium out?
Yeah, I don't know the answer to that, but that's they're afraid that if they do something, it may not be as delicious as has been. But actually, that's true for the dark chocolate, not as true for the relatively impotent light chocolate.
The milk chocolate.
Milk chocolate.
Milk, yeah, milk chocolate. Yeah. Well, now most of the chocolate that we consume is not dark chocolate. Dark chocolate is separate, and it hasn't lost the antioxidants. The chocolate that most of us eat, doesn't have as much of the antioxidants, and that's what makes dark chocolate more desirable.
Yeah, Dr. Callender, also noticed that California has a law about lead. Anything that you sell California, there has to be a disclaimer on it that this product contains lead.
Well, as we all know, what happened in Minnesota, and
Plant Michigan.
which was awful, and that was related to lead, and of course the paint. And so lead is toxic to the brain, and so having lead in it is very, very undesirable. Yeah. Okay, next one. This is interesting because canned tuna is we talk about tuna as being safe, and some consumer reports have found that there's too much mercury, and where's that come from? And contaminants that we put into the water. And mercury is another metal that should not be in the diet. And so we have to, so when they find that there are products that have lead in it, I'm sorry, mercury in it, it's undesirable because it affects the brain just like lead. And of course, the vegans would say, yeah, another reason why we don't eat consume anything that's animal. And so the heavy metals, mercury, lead, cadmium, they're all they're brain toxins. Yeah. So the effect on cognition is well known. And so when you find that these levels are high, then they should be eliminated. And that is the big concern about seafood, whether they have mercury or lead in them. Salmon, of course, is the same issue. And should they be tested? Should they know this before they distribute it? Yes, they should. But as you can see here, it's not always the case. This talks about how it comes down in the rain, and the animals consume it and are then consumed. And shark and swordfish. Okay. You may wonder why we keep trying to talk about keeping your heart healthy. Well, the heart and brain are two of the most important organs in the body. Of course, all of the organs are important, but with the heart beating, you have life. Without it, you don't. Diet and exercise become the very important ways to stay healthy. And the reason is because if you eliminate the diabetes, high blood pressure, and high cholesterol, then you have a likelihood of being healthy. But an unhealthy diet, lack of exercise, the opposite occurs. So diet and exercise is important, and of course, drinking more water. We talked about that before. How much water is enough water? I think there are a number of indicators. If your urine is the color of water or light yellow, then you're probably okay. 2 liters is thought to be the desirable amount of water you should take in every day, people. And the annual checkup, that's an interesting comment because the annual checkup has become something of concern, because what do you do in an annual checkup? And are you screening for protein in the urine? Are you making sure that the patient has had a colonoscopy or mammogram? Those are the things that are really important. And so if that annual physical does that, then that's fine. But it doesn't always do that. And of course, smoking, it's interesting. We've had more articles recently about alcohol, but smoking and alcohol are both dangerous to the health. However, alcohol is less talked about as a cause of cancer and other things than is smoking, but they're both poisonous. Then we talk less about the importance of sleep, but 7 to 9 hours of sleep every night is good for your health. And if you don't get 7 to 9 hours sleep, then it's unhealthy. And there's many studies that show the association of cardiovascular diseases relative to the lack of sleep. Of course, the biggest thing that you lose when you don't get enough sleep is the ability of the brain to clean itself. And so that's another attribute that we don't talk enough about. The importance of getting 7 to 9 hours of sleep. I know in our profession, in your training as a doctor, you rarely get more than 5 hours of sleep. And you get to think that that's the normal, but it isn't.
You know, as we look at the earthquake victims over in Turkey and Syria, and the ones that have been recovered living, it shows us really how the limits that we have expected for life expectancy have been altered. For instance, going without water for 3 days is supposed to be the maximum that you're able to sustain with life. And going without food, that can go up to 3 weeks. But some of these people have been there for so many more days than we had ever expected. We really don't know the full extent to which we can survive without certain food and liquid intakes. It's very interesting that we're finding these things out now.
Yeah, that's what is it? Is the number 35,000 deaths so far? Or is it higher?
It's up to 40. I think 41,000.
41. Woo. Boy, it's really horrifying to think how little power we have over things like that. Earthquakes, hurricanes, floods, in case you think we're potent, this is a good reason to rethink that.
I do know someone that has power over Bill.
What'd you say, John?
I said, I do know someone who has power over all of those.
Oh, yes, that's right. Yeah. We all know that God has the ultimate power of that. And we also know that these are the so-called last days, and there'll be more and more earthquakes and war. So,
something that wasn't on the list for heart health is the relation between heart and dental health, because
that's right.
there's increasing evidence that that the bacteria present in gum disease can travel throughout the body, triggering inflammation in heart vessels and infection in heart valves. And the plaque that forms on your teeth is the same type of plaque that builds up in your arteries and causes heart disease.
Good point. Thank you for bringing that up, because that's something that we tend to forget about. And so dental health is part of heart health. Very good point. Thank you.
That's very true. In particular, the dental, the upper mandible is more related to cerebral and heart infection than the lower jaws. So the teeth in the upper part of your mouth are really important in that regard. The blood-brain barrier is affected significantly.
This is interesting that the healthy lifestyle habits may cut risk of long COVID in half, which is another way of saying healthy lifestyle affects all aspects of life. And of course, that goes back to all of the things we've talked about so far: exercise, diet, and sleep. And they found that if you had all of these things together, the likelihood of developing long COVID was cut in half. I guess it's no surprise, but it's an interesting observation.
Doctor, is it too soon right now to determine what long COVID is doing to our lungs?
Well, I think that most of the people who recover from COVID, some have damage to the lungs. It's not too soon because we've now been dealing with COVID for 3 years. So,
Right, okay.
so we know that there are effects of the COVID on the lungs, but they're suggesting that if you have a healthy lifestyle, you're less likely to have that long COVID. But there are other aspects of COVID that we aren't quite clear on, because we know that the virus is all over the body. Whether it affects, to what extent it affects the kidneys or the brain is not as clear.
The question for me, Dr. Callender, is after COVID, what long-term damage is done to some of the respiratory organs?
There's most of the evidence suggests that once you get over COVID, that the lungs recover completely. It's just a group of people who have that so-called long COVID, who have problems with the brain as well as the lung. So that's why I guess not having long COVID is good, because then you don't have it. But the people who are called long COVID have persistent damage to different parts of the body. You know, some have kidney disease, some have brain fog, and some has, as you mentioned, respiratory problems. But this is the category of the patients who are called the long COVID patients. And it's thought that Paxlovid is a very good treatment for that, and that may be the way to avoid long COVID is if you get COVID to take Paxlovid. I think there's an article about that that's coming up.
I'm looking at this and it's saying that women are more likely than men to experience long COVID. Is there any explanation for that?
I mean, that's the truth, but why? I don't know.
Okay.
Yeah, that is clear that the women it's more, but we don't know why yet. Okay. This is an article that they're really fighting about. Gender transition ban. And what they're fighting about is whether or not minors should be allowed to have transition treatment. In other words, if you're under 18, are you old enough to actually have treatments that allow you to deal with your so-called gender dysphoria, which means that you're unhappy with the gender that you have been assigned. Basically, we talk about sex and gender and recognize the difference. Sex relates to the whether you're born with a penis or a vagina, a uterus, ovaries, and the like, and testes and so forth. Whereas gender is what your mind says to you that you are relative to whether you're male or female or neither. So whether that is a mental health condition or not is open to question for some, and they feel that this is something that if you have treatment for this and you're under 18, when you get older, you could sue your parents for you getting this gender treatment. And so as a consequence, there's some people want to block these plastic and reconstructive surgeries that minors can attain because they'd have to get parents' permission, and of course they want to do it without parental permission. And so this law would ban its availability to minors. And I don't know. Any of you have any feelings about that? This is
Callender, I wanted to know why you all call that a treatment. You know, you're saying gender transition treatment. Why is that a treatment?
Why is it a treatment? Oh, it's extensive treatment. It's extensive treatment.
You know, I think of a treatment as you have a disease, and then you have treatment for the disease.
Well, whatever you want to say, it is extensive treatment because you have to have sometimes replacement of organs or removal of organs, and you have being placed on estrogen or testosterone. So it's a treatment, all right. Whether you want to call it a disease or not is open to question, but it certainly is a treatment, extensive treatment for many.
Doctor, I don't know what state has the lowest age. I've heard of like 12 to 14 or something like that in regards to allowing this to happen. And I know as a 12-year-old, this 12-year-old, I'm still trying to figure out, at 12 years old, I'm still trying to figure out if I want to be a baseball player or a pirate, you know, and to be able to make that decision on your own, you know, I would hope that they would have to go through, well, I don't think, you know, yeah, I'm throwing my opinion on that, but, you know, I don't know what extensive psychological treatment that they go through before they're allowed to have such operations, because I'm seeing more and more of, you know, young adults coming back and saying, I wish I hadn't made that decision when I was 14 years old.
And sometimes you hear on the news where it's not the 12 and 14-year-olds, the parents get involved. And little Billy at 5 and 6 years old wanted to wear a dress, and then the parents support it and encourage it. And then they grow up into that mode. I would think at that age, they don't know, as Kevin is saying, they don't know what they want. But oftentimes in the media, it's the parents who chime in and support it, and they encourage that type of thinking. So what's right and what's wrong? I think it's good to have an age limit, at least 18, but when you talk about the 12 and 14, so often we hear of children much younger than that. But it bothers me that the parents support it, because that can affect the teenager later in life.
Right.
Dr. Callender, I have a friend who has a grandchild who they use puberty blockers. And puberty blockers, are they is that reversible, or is that a non-reversible procedure?
I don't know exactly what the puberty blockers are. I'd have to know exactly what they are to
Well, from my
because
understanding, they're saying that that's to stop the child from going from the transgender boy from going into puberty, to stop the I guess the hair and hormonal things that happen to you when you go through puberty.
yeah, it sounds like it's a hormonal treatment, but I don't know specifically what.
Okay.
And your question was whether it's reversible, and I don't
Right.
know. I don't know the answer to that question.
Mm.
So,
Question, Doc. Dr. Callender.
The internet says it's reversible, says there are no known irreversible effects of puberty blockers. If you decide to stop taking them, your body will go through puberty just the way it would have if you had not taken puberty blockers at all.
Thank you.
Um,
I had a quick question, Doc. I'm sorry. How prevalent is this LGBTQ condition?
I don't know. They said, they used to say it was 1 out of 6. Whether it's changed over time, I don't know. It seems to me that it may be more common than that, but at one time it was thought 1 out of 6. But we see so much of it now, you begin to wonder. But that could be because we're publicizing it more than we did in the past, because we hide it in the past. He would keep it a secret, and now it's publicized. So, but the garden variety statement was 1 in 6.
Thinking about the age, what you all were discussing, how young a child should be or how old they should be. I have a grandchild who was born male, but at an early age, he realized that he was female, or he felt like he was female. And he really struggled with it for a long time before he really did anything about it. And he has had some of those treatments to change his, but after he became an adult. But if you talking to him and listening to him, he said he realized that at a very early age, very early. So it's.
I have a question. Does the treatment involve surgery or is just medication?
David said that the treatment is the puberty blockers are drugs.
Yeah.
Okay, what about the treatment for what you're talking about? It's just drugs, there's no surgery, right?
For the puberty blockers is just medication.
It's medication. Yeah.
Okay, so when it involves operations to convert one sex, what's that called?
No, that's the gender affirming surgery, right? And so that does involve sterilizing surgery, as you see here: castration, hysterectomy, oophorectomy, orchiectomy, penectomy, and vasectomy. So that's what they're concerned about, because that's not reversible.
Yeah.
Okay.
Speaking again about my grandchild, he has not done all of that because of the expense, probably. But I'm sure, I feel like if he could have, he would have. But he does take the medication to keep the hair off and this type of thing. So
I had a question about those who are born with both organs,
Hermaphrodites.
both sexual organs.
Right. What about that?
That's different from what we're talking about. Right?
Completely different. Completely different.
So is there a point where those individuals would choose, and is that covered by insurance?
I have no idea. That is the true hermaphrodites is uncommon, and I don't know anything about that. So I'm unprepared to make any comment about the true hermaphrodite, where a person is born with the penis and the ovaries. So you have both there. And so how do they determine which way they're going to go? I have no idea. That's a subject I can't give you any opinion on. But these are issues that are occurring every day. And so the gender affirming surgeries are something that we have to deal with. And question is, are we going to do something that's irreversible that the person may regret when they become an adult?
Well, under the hermaphrodite question, vaginoplasty is covered by 97% of insurance companies, and penectomy is covered by 95% of insurance companies. And so that's the decision that a hermaphrodite would make, which organ to remove.
And the question is, when would they make that? And that's what is problematic at what age, because you're born with that. So it's not that you have to wait till you're 18. The question is, would the parents have to make that decision, or how would they make that decision? That's a true issue that we'll have to get some expert to give us some ideas about. That's beyond my.
Dr. Callender,
Yes.
Dr. Callender, what I worry about is these legislators, the bent of these laws are discriminatory. And the same people that want to discriminate against Black people are the same people that are discriminating against people that have this issue. And they're trying, they're using that as a tactic. All these, making all these laws against transgender people and controlling people's reproductive rights and all these things. I don't think the legislators should get into that. I think that's something that should be done between the doctor and the patient. And it bothers me when I hear all these laws that they have, like the ones that they're trying to get in Virginia against transgender people, because it fuels the crazy people. When you have discriminatory, when they have people that they think that they're better than, then it fuels the craziness in people, and I don't think it should be legislated.
Okay. Any other thoughts on this before we move forward? This is a sad state of affairs that we find ourselves in. That look at the rate of hopelessness in males and females, and it's gone up in both, but it's beyond belief what has happened with the females. And as a consequence, suicide is considered more than ever. 30% say they seriously considered attempting suicide. And 18% reported experiencing sexual violence. And 14% reported being forced to have sex. For every 10 teen-year-old girls, at least one of them has been raped, which is a sad commentary, but probably nothing that the teachers aren't aware of already. And then if you're an LGBT, of course, their suicide rates are much higher than any other group. So this tells us, it tells us that we've got a huge problem in our young people. And hopelessness is tough, especially if you have nothing to hold on to, whether it's a God to hold on, or Christ to hold on to, or something. Hopelessness then is something that is very undesirable. Dr. Ivy, you want to say something?
Oh no, not right now. Thank you.
No, it's very difficult to accept the increase in hopelessness with young ladies compared now with 10, 15 years ago. The life in this country and in the world has changed so much, and the COVID has not helped the isolation that we've all gone through. and children are particularly more affected. But it's manifest more in women because you don't have men or boys being raped. It's the girls. I don't know. I think we need to get some psychiatric evaluation or someone to discuss that with us. But I can't add a whole lot to that.
Well, here's my comment. Kids these days, and when I'm talking about kids, I'm talking about under 30 years old. They've all been raised on pornography. This is how they grow up. I mean, if you got a 11-year-old girl out there, she has probably watched porn. And okay, I'm reading on the internet. It says many studies do conclude that pornography indeed causes and increases rape. So, I think that ties into the that percentage that talks about how many girls have been raped, and it's on the increase with pornography. And then the second thing that makes girls feel badly about themselves and depresses them is social media. We know that America, we're getting fatter, but social media, what girls see is getting prettier and skinnier. So they don't measure up. Social media does nothing but depress our young girls. The best thing that you could do for a kid, keep them off social media, make sure that you control their digital devices so they don't watch porn, because the combination of those two is a double whammy for our kids.
I agree with Daryl. I agree with Daryl there as far as social media.
Any other comments on this subject?
Yeah, I think that young boys don't get good role models of how gentlemen are supposed to act. So many young boys don't know the things to say and the things not to say to a young woman, and a young woman doesn't know what a young man should say. To give you an example, I was with my goddaughter, one of my goddaughters is 13 years old, and a young boy walked up to her and in front of me told her that he liked how her behind looked. Now in our day, wouldn't no boy have ever said anything like that. But nowadays they see it on TV, they see it on the videos, they see it on movies, and people that they respect more people outside of the home than inside of the home.
But I think in addition, I think girls dress more provocatively now than they did when we were growing up.
But the thing is, I don't care what a person has on, what comes out of your mouth should be civil. Because then if you say that, then that's the slippery slope. You were raped because you were there. You weren't raped because you had a short skirt on, or you weren't approached because you had a short skirt on. You were approached because the person felt comfortable to approach you. So that's just my thing. I don't think kids get the proper socialization. They don't see the
Where are they supposed to get it from? Where are they supposed to get it from?
Well, when I was in school, we were taught how to approach somebody, to ask a young lady to dance. And when you dance with somebody,
Who is the somebody?
well, we did it in gym class. That's where we learned to dance.
You should get it at home.
Right. It starts at home.
You should get it at
Right.
home.
It starts at home, but a whole lot of children don't get much of anything but shelter at home.
But that's the problem. That is the problem, though.
Yeah, that is the problem, but you can't legislate that.
You can't legislate anything, but I'm saying that it all begins in the situation where we want to make more money, and therefore we don't take care of our children, and so they grow up without any role models, and as a consequence, they have behavior that's unacceptable. But it is begin in the home.
That's true.
I would like to introduce or tell you, everybody's just about right. Media and raising children these days. When you're teenagers, you go with the trend. The trend is for women to reveal, girls to reveal more. You send a girl to school all covered up, her peers will, and everybody will make fun of her because she is not dressed to the style. That has happened from time A. When my boys were young, television, when they had Vanity Fair and all of this, we forgot that women try to think that it's a man's fault. Women, when we show this stuff, that's how men are attracted to us in the first place. Well, just don't look. That is stupid. That's how they're attracted to you. And then if you're going to show them everything, and that's the style, I had to say, turn off the TV during the time, because young boys visually, that starts early. It's nature. It's what happens to men. Women forgot that men look, and I don't know what happens to men that can't see, but visually, men react when they see a naked female. The porn out there, television, it's ridiculous. You used to not see women and men who were even, I Love Lucy. They slept in separate beds. Now you can look on television and everybody's on top of everybody and naked. There is nothing so the children are inundated to this. They have natural urges. Gym used to be girls and boys separate. Now they have gym the same time. So if a girl comes on her period, every boy knows that she's on her period. And they talk about it. They're free about it. Sexuality is so free. And we can't talk about what happened in our day. It's no longer our day. So we say what's home. Children are left home by themselves, latchkey. So the only thing that they got is social media. Women have been raped, but they're being raped even more because we're throwing the boys and girls together with no supervision. Girls are left home unprotected. It is something, and that why they're getting depressed. Women have gotten depressed from being raped, but it's more and more. So the suicide, this is something that our culture is perpetuating in every aspect going through media. And what to do about it, it's hard. I stay in prayer for this generation. I can't say what happened to me when I was growing up because that's no longer happening. Girls can get on boys' football team, go in their locker. They got to have separate locker rooms and everything. We're going a little bit too overboard, and we're forgetting that we are two sexes, male and females. Males look, women want to be noticed. So like I told my daughter one time, by the time she's my age, the way the style was going, she's going to be butt naked because the style says reveal more.
But Carol, that's happening now. I think
Dr. Atto has his hand up. Dr. Atto has his hand up.
Yes. There are two words that struck me when I saw this. When it was highlighted, sad and hopeless. In my area where I grew up, even now up to today, what I feel that boys and girls who fall into that category of sadness and hopelessness, 95% of them are from poor background, poor family setting. They want to get the things that people from the rich families have. You see youngsters driving cars at very early age nowadays, showing off with high-end phones, displaying clothes, very high-end clothes. So the poor people always feel very sad. They want to get, they just regret being born. I don't know how you all feel about it and how it's different from what is happening in the United States now.
Okay, I think we've discussed it. I guess we can move on. It's almost 10:30. This is a great subject because it allows us to try to see if we can get our psychology folks to address some of these issues, because this is teenage violence and teenage suicide. It's particularly problematic in the African American population. And so this is something that requires an in-depth look and to figure out what we can do to overcome it. I think all of the comments have been right on target. The question is, what's the way to overcome this problem? Let's go to the next one. Yeah, let's go to the next one. Yeah, and then of course the suicide rates rise, and of course it's highest among the American Indians or Alaskan Natives. The greatest decreases in white individuals. It's interesting that the minority population seems to always hurt more by any of these negative changes. Also, we know that this increased among the Black teenagers as well. And this is reflected here as well. There was a time when Blacks weren't committing suicide. That has changed. We want to be like everybody else, and we are. And particularly in the 10 to 24 age group, which is a problem. So the question is, what can we do to help our young teenagers, Blacks, who are more hopeless than they were before? And we know that the pandemic has made things even worse. So mental health is an issue that we have to address. This article that you have here is one that is really painful. When you think of euthanizing, which means that you allow somebody to be put to death at the age of 23-year-old. She was close to a blast, and there were so many other people in the airport that were killed that she never actually ever recovered. She already had other issues before that, but then after the attack, she never got over it. In spite of all the medications, she attempted suicide again and again. They then got in touch, and this is in a country where euthanasia is acceptable, and it's just hard to believe that somebody at 23 is incapable of recovery, but that is what happened in this case.
I think we should possibly have someone to discuss with us the 6-year-old kid in Virginia who shot the teacher.
Yeah, right.
Supposedly a terror in the school from kindergarten. And how does this work? And there's always described as some undescribed problem that the kid has.
Yeah, she had a gun. That's the she had a gun.
Yeah.
Well, why does a kid 6-year-old have a gun?
Right. And why was she choking her kindergarten teacher? Why is she a hazard in the hall?
And why hadn't that child been evaluated to keep the child out of that classroom, but into another learning environment? All of the teachers, everyone said that child had a problem, and they knew it.
And her parents had to accompany her to school, to school. So what kind of problem was this? Speaking of this young girl, 23, with euthanasia, is this kid a menace from age 5? And he's growing into that same problem that's incorrigible and uncorrectable? We need to discuss that perhaps one time.
Yeah, I guess we will. We'll get one of the psychiatrists psychologists to help us.
But you do know this is not extraordinary. This happens a lot in the schools where teachers you have a child that is uncontrollable. I've had them where they're biting and hitting and they tell you there's nothing a teacher can do. they're just a child and they're seeking help for them, but you got to keep them, you see all the red flags, but they're protected, and don't let them get the label of special education, because once they got their label of that, there is nothing, a teacher cannot even defend himself. You write all these reports and they'll say, we're working on them. But there are I would say it doesn't matter what economic, there are in every school, there is some child that is like that. So, you know, once they get into the newspaper and everybody's going, oh, wow, you know, but I've seen it a lot.
Yes.
That's true. My niece is a teacher, and she teaches the third grade, second grade, third grade, one of those. And since day one, the school year in September, she's had this student who obviously she could tell had a problem. And of course, she reported it to the principal. And as Carol said, you have to document. Well, they've been documenting. She'll scream, she'll bite, she'll throw things. She's not learning. It's difficult for the other kids to learn. At gym, they go to another area in the school, the cafeteria, someplace to take gym class. And this one particular day, she went up on the stage. Teacher kept telling her to come down. She went up on the stage. She fell and head bleeding, ear bleeding, was in the hospital for several weeks. She had a concussion after the hospital and so-called healed. She's back in the school. How much documentation do you have to do? And as my niece is saying, we're nearing the end of the school year. Obviously, she has to retain her. She's not learning anything, not learning anything. She's tried calling the parents in, and the grandparent will come in and try to understand. The mother is somewhat similar to the student. And my niece is saying she's between a rock and a hard place. But she's gotten the class to kind of calm down now. At the beginning of the school year, they're all afraid. What's wrong with this student? But you have to have them in the class because of documentation.
Yes.
It's scary.
Yeah.
Mhm.
So we need well, we know, remember we had a child psychiatrist who talked to us, so I'll give her a call and see if join us. Okay, this I just put this in here because I've read about everything, but see somebody come from a nursing home pronounced dead and go to the funeral home and be found alive is something that is frightening. And the question, mistake or malpractice, it's both. And the question is, how do we prevent things like this from happening again? And suing the care facility is not enough. But anyway, that's all that was done in this case.
But in that same line, I would mention, when I was in New York, I was called to a funeral home because the patient's heart was still beating. And they couldn't show the patient at the funeral. The patient had had a pacemaker put in at my institution, Cornell. And some years later, he died. So I had to go to the funeral home at night and disconnect the pacemaker so that the funeral could be conducted.
That is, I never heard that one before.
Yeah, I hadn't either at the time.
Wow. Amazing.
Thank you, heaven.
Betty, you had a comment or?
No.
Oh, okay.
Wow.
Yeah, that's wow. Well, anyway, it's just kind of problematic that nursing homes are unable to recognize vital signs.
I'm sorry to interrupt, but I just saw that there are Bluetooth enabled pacemakers now. So that may allow you to turn off the pacemaker by Bluetooth?
Well,
Yeah,
we are definitely progressing. We have all sorts of controls now for pacemakers, but that's a good thought. We didn't have it at the time that I was called in.
Well, facial transplants are something that are now done, and we had our first African American recipient of a face transplant. He's now 3 years after transplant, and the question is, there are very few. As a matter of fact, he's the only facial African American facial transplant recipient, and there are very few Blacks who actually have vascularized composite allotransplantations, which means transplants of the face and the arms and the uterus and the penis and so forth and so on. And so it's important to realize that you can have your loved one's face removed and given to somebody else. Of course.
What?
Yeah.
that's a
So
transplant.
you can have organ transplants, you can have tissue transplants, and you can have face transplants.
Yes.
And so it's important for us to be aware of this. And what is the consequence of you seeing somebody else who has your loved one's face? And so this is a recognition that for the deceased donor family, a face transplant is more than just a notion, but it's something that our future has in store for us, so that we should be aware of the way in which transplantation has changed. We talk about xenotransplantation, transplant from other species, pigs and so forth. And now we're also talking about not only transplants of organs and tissues, but also of the face. So just to make you aware of the fact that that is now ongoing. Any comments?
Yeah, Dr. Callender, who gives the final okay for that transplant? I thought it was, when you put that on your driver's license, and that you are volunteering to be an organ donor. Is that is that all that's needed to be a facial?
No.
Or does the
No,
family?
that is for organs. Face is not considered an organ; it's a tissue, and in many ways, it is separate, and you have to have special permission for that. And so, in those situations, they've gone to the family,
Okay.
and gotten permission. Whereas for the organ, any of the 8 organs that can be used, that is befitting for that, but for the face, that's different. And this is to recognize that this is a difference that must be made. And now we do have it's interesting because the facial transplant recipient, he's 58 years old, 68, and he turned down the first face because it wasn't the right complexion. As you know, there's so many different shades that you can have for a complexion, but he turned the first one down because it wasn't the right complexion.
What was wrong with him that he needed one?
Burn.
Oh,
Very- yeah. Yeah. Well, but there are many reasons why people need face transplants. Burn is one of them. Or have an animal, or being an accident.
yeah.
Fire is often the case, but sometimes people have pets that destroy their face. So there are many ways in which the face can be destroyed. Now, this is the last slide I guess we have. It's almost, we're moving towards 11 o'clock. So this will be the last one, but I thought it would be appropriate since most of us are in the category of being over 50. And the question is, is it worth it? And I think, as I think about this, I have two or three people in my church who had knee joint replacements, hip replacements, and other surgeries, and done successfully. And patients over 90 are having open heart surgery as well as other surgeries. So the question is, when you're over 65, is it safe for you to have major surgery? And of course, there's a lot of statistics on it, as you can see here. 33% of patients suffer from dementia die within a year of having major surgery, but that's still a year. 28% of the patients with frailty die within a year after major surgery, and actually, some would argue that frailty is contraindication for major surgery. Unless you have, unless you have a emergency situation, you wouldn't do surgery on frail patients. But there are risks, especially for the older seniors in 80, 90. Should you have surgery if you are over 90? And the answer is yes, under certain circumstances where it's life-saving, where it's emergency. But what about elective surgery? Yes, for hip replacement and knee joint replacement. If you're having so much pain, yes. So that yes, there are alternatives to surgery, but often these alternatives are not. As surgeons, they resort to surgery after all the others have failed. And so the important thing about whether you decide to have surgery for the elderly is whether you're talking about emergency surgery or you're talking about major surgery, and is the patient informed? Do they know all of the options? Do they know what would happen if they have surgery? What would happen if they don't have surgery? And it is how long will it take for them to recover? Will they have to go to a nursing home? All of these questions. And when you have informed consent, then I think, and they understand the risks involved, then it's probably okay to proceed with surgery in the elderly.
I think also the consideration of chronologic age as opposed to physiologic age. Some people may be 95 years old, but seem like they're 80 or younger. It depends on many factors in addition to what Dr. Callender has said.
Absolutely. Any other comment about this?
My mom was quite old. She was in her mid 80s, and she had heart surgery. Well, actually, she had aneurysm surgery before, when they found out that she had an aneurysm. They had to do the heart before they did the aneurysm. So she was like in her 84, 85 when she had that, and she came out of that fine. And then in her early 90s, she fell and broke her hip, and they did that. So me, as I said, I'm going in to have hip surgery, and I'm in my 70s, so I feel like I'm a youngster as compared to what she went through in her older age.
Yeah. Well, Sally Cheston, who was that? That she knew?